Okay, this video is what causes blood clots, and where does this come from? It comes from that I've had the experience of talking to a lot of young doctors, and they have patients with blood clots. In the movies, people die from bleeding. It's a gunshot, a stab, a knife, and blood on the carpet, and it's a big disaster. Oh my goodness. Okay, and that's in the movies. In real life, people die from blood clots. Most of the time, it's a blood clot. Blood clot in the artery of the heart, that's a heart attack. A blood clot in the artery of the brain, that's a stroke. Okay, blood clots all over the place cause tissue hypoxia, lack of oxygen, and increase the risk of cancer, degenerate things all over the place. All right, so anyways, what I'm trying to say is the main reason people die is from blood clots. So it's good to know what causes blood clots. And what I've noticed is conventional medicine, as usual, is kind of stupid. Remember the movie Casablanca, where something happened and then they said, well, what should we do? Round up the usual suspects. So they would arrest a whole bunch of people that had nothing to do with the problem, but just to make it look like they were trying to find who caused it. And so what I'm trying to say is, when a patient has a blood clot in conventional medicine, something like because they had a heart attack, a leg clot, deep vein thrombosis, a pulmonary embolism, intracranial dural sinus thrombosis of the veins in the brain, or something else. Sometimes there's an obvious cause. If you have an adjacent mastoid infection, mastoiditis with breakthrough through the bone, tegmen tympani or something, spread into the brain, that can cause a clot in the adjacent vein in the brain. If you got a frontal sinus sinusitis extending posteriorly, can cause infection in the brain and a blood clot. If you got a problem with the leg that's obvious, you have a patient that's got a lot of stasis sitting around post-op, they get a leg DVT, deep vein thrombosis, after a knee replacement. I've seen a couple of people die from that after knee replacement and hip replacement as well. All right, so anyways, the reason I'm going through this is what they typically do is they check for all this rare stuff, protein S, protein C, factor V, Leiden factor, all this, a bunch of zebras. So the old saying is when you hear hoofbeats, think of horses. Don't think of zebras, don't think of okapis, don't think of unicorns, think of horses. Okay, but in order to think of horses, you have to know what a horse is, the common causes of blood clotting. And conventional doctors don't know this. As a matter of fact, I've had the experience of talking to them on the phone, and they all start giving me this, are you for real? Are you full of shit? What are you saying? Because I start telling them stuff, they've never heard these things before. So I'm just going to go through with you what causes blood clots in the real world. The other thing is, the way people think it's naturally kind of simple-minded, they want 1 + 1 = 2. But with blood clotting, it's not like that. It's quite often there's 5, 10 things that are all adding up to make the patient more prothrombotic. So you want to tip the balance away from clotting. So let's talk about it. The typical American male is, iron overloaded after about 25 years of age. Typical female, maybe around 5 years or so or more after postmenopausal, they stop menstruating. When you become iron overloaded, that means you sort of exhausted the binding capacity within your intracellular space with the ferritin protein. Ferritin and intracellular protein can hold like 4,500 molecules of iron. And it does that to keep the iron available in case you have a lot of bleeding, like our ancestors might have bled being scratched or bitten by a predator. But for us, that day never comes. So the iron just overloads. When it starts getting free, it gets into the blood and it causes ferrous redox cycling between Fe2 plus Fe3 plus. And that'll cause amyloid clotting because it'll change the shape of fibrinogen, the blood clotting protein, from alpha helix cylindrical to beta pleated sheet, secondary protein structure. And then it will, beta pleated sheets, they're flat, they form hydrogen bonds between each other. And that raises the size of the molecular weight. Increased molecular weight in aqueous solution predisposes to thrombosis, and it's a refractory type of thrombosis, meaning it causes clotting. To precipitate in the blood is to clot. And it's refractory to lysis, means it's hard to dissolve. And that's your typical thing with leaky gut as well. So if you got leaky gut for numerous reasons, lack of dietary fiber, too much dietary oils, you're drinking tap water unfiltered, the fluoride, the aluminum, all of those things predispose to leaky gut, okay? So does glyphosate. You're eating non-organic food. Those are all no-nos. All right, so anyways, all those things predispose to clotting. Typically those clots, amyloid clots, are 2 to 200 microns in shape. They'll start plugging up arteries, and they can, in conjunction with other things, predispose to bigger clots. If you eat a high sodium diet, the high salt causes platelet activation. It also inhibits endothelial nitric oxide, which thus leads to more platelet activation because, nitric oxide inhibits platelet activation. Platelet activation means to make the platelets sticky, predisposed to clotting. Eat more plant foods because then you get more nitrate precursors to make nitric oxide, the whole oral pathway. In the mouth, nitrates, NO3s go to nitrites on the back of the tongue, bacterial conversion to NO2s. Into the stomach, the acid converts into nitric oxide, travels throughout the body, systemic vasodilation. Sunshine also releases nitric oxide precursors from the skin, so that also helps prevent you from clotting. It's partly why it feels so good when you walk out in the sun. Hydration, being well hydrated, lowers your blood viscosity, makes your blood less thick. That decreases your tendency to clot. Avoid dietary fat. Dietary fat, LDL cholesterol, chylomicrons, triglycerides, they all function as bridging molecules to get the red blood cells to stick together. They overcome the zeta potential, the negative charge on red blood cells. I've never in my life met a doctor who's ever heard of zeta potential, and it's the most basic thing. All red blood cells have a negative charge on their outer surface, which is good, so they repel each other. But something of big enough size with a positive charge can be a bridging molecule, stick them together. That's why you don't want to eat these high-fat diets. And that includes PUFAs, polyunsaturated fatty acids, all these omega-6 oils. You don't want them. I don't care what Viva or anybody else says, the high-fat phonies. Oils are not good for health, and that's well known. Okay, avoid unnecessary psychological stress because it elevates fibrinogen, the blood clotting factor, and it raises blood pressure and it raises blood lipids, so it increases the risk of clotting. Remember, stress is everything that relates to being chased by a tiger in the dark. It scratches you, you want to clot faster so you don't bleed so much. And same thing effect is psychological stress. If you're drinking coffee, the caffeine does the same thing. If you're sleep deprived, they both elevate cortisol and catecholamines, which drives up blood lipids, raises blood clotting factors like fibrinogen. So you want to make sure you're getting adequate sleep as best you can. Do not drink coffee or tea. Caffeine is bad for you. I made entire separate lectures on the subject, but just as a reminder, you can check out the book Caffeine Blues. I did a book report on that, a book review. Avoid calcium supplements. When you get the calcium supplements over 1,400 milligrams per day, there's a 2.6 times increased death rate from a heart attack, and it's thought because you cause a transient bolus in the calcium levels in the blood, and calcium is a clotting factor, so you get a transient hyperthrombotic effect, which will predispose to heart attack, myocardial infarction. Moderate exercise is good. That helps prevent stasis, helps prevent blood flow. So prolonged travel, like sitting on, in a car or an airplane a prolonged amount of time, will increase your risk of forming a blood clot. If you're post-operative, when you're post-op, the typical stupid patient says, I'm in pain, give me pain medicines. I can tell you, I got doctor friends that went for surgery. They get up and start moving as fast as possible. They'll typically sign themselves out AMA as fast as they can. They want to get home. They don't want to sit around the hospital. The confused patient who's ignorant, doesn't know anything, sits around in bed, give me some pain meds, and they don't want to move. They're likely to have increased complications, form clots, deep vein thrombosis, etc. So avoid things that cause leaky gut. Also cause leaky gums in your mouth. If you've got poor dentition, you might be having bacteria from your mouth getting into your blood. So you want to take real good care of your teeth. That's why I don't like the sugar diet. Even though it can give you a transient bump up in energy, for a competition, for running or bicycling, I think it's a very bad idea as a habit because a lot of people are vulnerable to getting cavities, myself, and there's some people are vulnerable to rebound hypoglycemia. Daily sugar, high sugar, simple sugar intake increases the risk of leaky gut, which you don't want. And then if you damage your teeth, then you have all the leaky gums and you get bacteria in your blood from that. Avoid fluoride toothpaste and mouthwash because it kills the bacteria in the back of the tongue. Then you block the nitric oxide cycle because you can't convert the nitrates from the plants into nitrites, NO3s to NO2s. So you are predisposed to be hypertensive and you're predisposed to have platelet activation if you do that. Be wary of taking medicines like oral contraceptive pills, birth conceptive pills, because all the high estrogenics, they're prothrombotic. Be careful with hormone replacement therapy, postmenopausal. When women are pregnant and in the postpartum phase, they have an increased risk of forming a blood clot. Avoid all these fake sweeteners are bad. Xylitol is prothrombotic, for example. Avoid things that cause insulin resistance, like dietary fat. Avoid high fructose corn syrup. Diabetes causes a microvasculopathy that's prothrombotic. You start running all these side pathways with the advanced glycation end products. It ends up being prothrombotic. Avoid high fructose corn syrup. It ends up becoming a bridging molecule. It increases uric acid when you eat a lot of high fructose corn syrup, like from processed food. Avoid meat for additional reasons. Besides all the fat, it also predisposes to leaky gut. Then you get the postprandial endotoxemia from the leaky gut, LPS from gram-negative bacteria, LTA from gram-positive bacteria. They're both very prothrombotic and cause amyloid clotting. Again, that transformation of fibrinogen, the blood clotting protein from alpha helix to beta-pleated sheet, Okay, that's called an amyloid clot. The change secondary protein structure is an amyloid transformation. And those clots, again, are difficult to lyse, difficult to dissolve. Have a strong sense of purpose in your life, because that makes you more resilient. You know, if you feel like I'm doing what I should be doing, then you can tolerate all the inevitable hassles and humiliations and setbacks that are just part of life. So having a strong sense of purpose lowers your stress level for that reason. Being religious lowers your stress level. You sort of give it over to God. That's good. And also keep peace of mind. Don't get yourself into BS for no reason, okay? Avoid crowded public places. What good comes from that, you know? I don't like going to rock concerts. I don't like hanging around in crowded public places. For what? What good comes from it? Nothing. Okay, rock concerts will make you deaf. Avoid excessive cold. It's prothrombotic. I like to be warm. I always either have the heat up a little bit or I wear jackets or something when I'm indoors. I like to be warm. I know it makes me think better. I think it speeds up the rate at which chemical reactions occur. You know, you don't overdo it, but just a little bit. Avoid alcohol. Predisposes to fatty liver and makes you prothrombotic. Okay, other things that can make you prothrombotic. The point I'm going through all this is there's a lot of stuff you could do. As you get older, you get a little more prothrombotic. Avoid tobacco, increase platelet activation. We talked about excess stress. Avoid excess air pollution, diesel exhaust. That's all prothrombotic. Let's see, what else? High MSG, MFG. That'll elevate your cortisol a little bit. A bit of a vicious cycle there. So you don't want to be eating that processed food. You want to eat organic only, whole foods, intact foods, because they can put MSG on organic food too. So we want a single ingredient whole foods. TMAO from meats, a little bit prothrombotic. When you eat the plants, you get dietary potassium and magnesium, which are antithrombotic, because then your endothelial nitric oxide will work better, your plasma membrane ion pumps will work better. Okay, we talked about dehydration already. Chronic kidney failure will make you prothrombotic, so you got to be careful if you have that, to be extra careful with all this other stuff. Let's see. We pretty much covered most of this stuff. Let's see what else. Cell phones are a little bit prothrombotic. Like, I think it's very stupid to put your cell phone in your front pocket, because it's having a little bit of a sympathetic effect and a localized rouleau formation. It's been shown to cause localized formation, rouleau formation, sticking together of red blood cells in the blood. So if you got it right over your heart, it's been known to change EKG as well. You're just making the blood vessels of your heart a little more prothrombotic. That's a very stupid thing to do. It also, if you do it for over a decade, it'll increase your risk of breast cancer. So it's a stupid thing to do, to put your cell phone in your front pocket of your shirt. Stupid to put it in your pants pocket too. For a man, you're putting it right next to your cojones, and it'll decrease your testicular function. You're going to lower your sperm counts. You're going to lower your testosterone. Like I said, I see these stupid young guys, they go to the gym and they got their cell phone in their front pocket. I'm like, dude, that's counterproductive to microwave your balls while you're working out, don't you think, genius? Okay, MSG, like I said, it'll increase the risk of AFib. It also will increase cortisol. It has this, so it's a little bit prothrombotic in that sense. It also decreases testicular function. You don't want to avoid it. It's real bad. So anyways, those are some things. So when you do a workup of a patient for hypercoagulability, you could also teach them these things. Now, I realize in real life, most of the patients are cognitively slow. They're old, they're sick, they're debilitated, and the doctor doesn't even know what to tell them. So there's a big missed opportunity for preventing blood clots. It's well worth knowing these things, because you can dramatically lower your risk of a heart attack, a deep vein thrombosis, a pulmonary embolism, etc. Anyways, I hope you found that helpful.